The Kindness in Small Zone is a space dedicated to promoting well-being, kindness, and learning together. We host webinars like this to share knowledge and practical tips on important medical topics. I founded the Kindness in Small Zone in June of 2025 to bring smiles and kindness to children across the globe. Except for webinars, we post weekly activity packs, kindness cards, coloring pages, and blogs, as well as resources for children facing difficult situations. As a young patient myself, I understand the importance of this and invite you to visit our website for more information. I'm thrilled to introduce our guest speaker, Sulaf, a third-year MD student.
Hello, everyone. Today's topic is a really interesting topic, and it is one of the most important parts of a really great specialty called public health. Today, we are going to talk about contagious diseases, which are the diseases that can be transmitted between people and sometimes called risky diseases. Okay, so public health is the specialty that is concerned with connecting medicine with societies and communities and simplifying medicine to people. So you see, these general rules that you know that feels common sense for you, like for example, you must wash your hands before you eat something, or you must wear a mask if you are going to a hospital or to, for example, a crowded place. These rules are not just common sense, they are rules that are made by public health institutions and by institutions that care about protecting communities from, let us say, risky diseases. Public health is divided into a lot of areas. You have the contagious diseases, which is our topic for today, or the infectious diseases. You have the non-contagious diseases, or let us say they are also called the non-communicable diseases. And you have also the maternal health, the mental health, etc., etc. So for our today's topic, we're going to start by knowing the difference between contagious and non-contagious diseases. The contagious diseases are the diseases that are made by, let us say, that are caused by living microorganisms, organisms that you can't see. So, you know, there are viruses, bacteria, parasites, etc. These viruses can get into your body, can cause you a disease or what they call an infection. And also, after they finish, they can go to another person and to another person. So they can reach you from an animal, from a friend, or also by eating an unclean food. So contagious diseases are the diseases that are caused by an infectious agent or by a microorganism, and at the same time, the disease that can be transmitted between people. On the other side, the non-contagious diseases are the diseases that are they are not caused by an organism, they are not caused by something, they happen to your body because your body is not well. There is something, let us say there is an issue in your body. For example, it could be a genetic thing, it could be a metabolic degenerative thing, or let us simplify everything. It might be caused because your lifestyle is not really well. So, for example, you are eating a lot of cholesterol. You are not that fit enough. So when you are at your 50s or 60s, you can get a heart disease. This heart disease, or for example, diabetes, cancer, or hypertension, they are non-contagious diseases. If your friend have one of them, it's not going to transmit to you. It's not going to infect you because it is a non-communicable disease. On the other side, the contagious diseases, for example, you have the virus, a flu, for example, it can transmit to you and it can reach you. The diseases that you must be worried about from reaching you, and the diseases that we must have certain precautions to protect ourselves from, are the contagious diseases. In order to protect yourself from any infectious disease or any contagious disease, you must understand how they actually reaches your body. And this is what public health institutions work on. So they designed something called the transmission chain of an infectious disease, of an infectious organism. Let us say that it's like a cycle. A microorganism, for example, a bacteria or a virus, will reach your body through something called a route of entry, or let us call it a gate of entry. For example, you eat it, so it could be your mouth, or you smell it, it could be your let us say your nose, or you touch something that is not really clean, so it will be your hand. So the route of entry, it will enter your body, it will process in your body, it will cause you a disease, it will duplicate, and then it will go out of your body with which is called a route of exit or a gate of exit. So when it gets out of your body, it will go to your friend or to another person, and it will infect that another person through a route of entry, and repeat the cycle again and again. So understanding how disease transmission works will help us to find new ways and to find creative methods to prevent these diseases from reaching us. So the methods of transmission for microorganisms, first you have the person-to-person contact, which may happen by shaking hands, for example, or hugging. Let me give you an example. In this, there is a disease called leishmania. Leishmania can reach your body by an insect bite. So its route of transmission will be the skin. It will bite your skin. It will introduce this microorganism into your blood. It will process in your body and appear as sores. Okay, it will appear as sores, or cuts on your skin. So when anyone touch the skin or touch the sores on your hand, or for example, if another insect gets on your sores, it will take these microorganisms and transmit it to another person. So person-to-person contact is one of the methods of disease transmissions for these microorganisms. The second method is respiratory droplets or airborne spread. For example, you have our famous example. For example, you have COVID-19. COVID actually transmits through our respiratory system. When you sneeze, if someone who have a COVID-19 sneeze, for example, the virus is going to get out of your body or out of their body as respiratory droplets. They're going to be really small dots that they are invisible, you can see them. They're going to get on surfaces, or if the other person is not wearing a mask, is going to enter directly through their nose. And this is how these kind of diseases, the respiratory diseases, for example, COVID-19, flu, they can transmit through respiratory droplets, through our respiratory system. Our third method is contaminated surfaces. As we said before, the respiratory droplets can get onto surfaces, tables, chairs. For example, you have the insects, as we said before, not the leishmania one. A lot of insects, for example, mosquitoes, worms, etc., they can reach, I'm sorry to mention that, but they can reach garbages, sewers, etc. They can reach them. They can collect microorganisms from there and put them onto our surfaces, for example, tables, if they are not cleaned well. So anyone who touched these tables, who, for example, start putting their stuff on their table, they can transmit their disease to themselves, okay? The fourth method is through blood or body fluids, and this one is actually for hospital staff or healthcare staff. You should know that healthcare staff are really careful about this point. So they wear really heavy gloves, and they are really careful about this one, so they are not going to transmit easily. But in general, if they have a patient and they are giving them a needle, if they cut themselves by accident with the same needle they used for the patient, they're going to transmit that microorganism into their blood directly, and thus they're going to get that infection. So public health workers advised the healthcare workers to wear really thick gloves. So if they wore really thick gloves, these needles cannot get into their skin by accident, right? Okay, so transmission actually depends on the pathogen itself, and especially depends on your immunity, because your immune system, the system that defends your body, these diseases are going to be transmitted into your body for sure, but your immune system is going to defend you and is going to kill these microorganisms easily because you are, let us say, a healthy and a normal person. The people who are at risk the most are the people who have really weak immune system. For example, elderly individuals, people who are at their 80s or at their 90s, their immune system is just tired from this long life and is going to be weaker than anyone. Also, you have infants and children, especially the newborns. It's an interesting thing for you to know is that newborns actually, they are born with half of their immune system. Your immune system is developing while you are getting older. So while they were in their, before they getting born, they were relying on their mother's immune system. So that's why newborns have just a half immunity. They don't have their full immunity yet. So having a flu for them is actually hard. The third point, which is really interesting, the immunocompromised patients. I don't know if you heard about this term before, but immunocompromised patients are the patients who have really, really, really poor immunity, which could be worse than elderly and infants. There are two major groups of patients at the hospitals that are considered immunocompromised. First, you have the patients who are receiving a treatment for cancer. And second, the patients who just transmitted a new organ. For example, someone having a kidney failure and they have got a new kidney, okay, at the hospital. So these two groups have really, really poor immunity. Not for their whole life, but just until they finish their treatment. I don't know if you visited someone at the hospital who is considered immunocompromised, but usually doctors tell patients, parents, or visitors to stay really far from them, to wear masks, to wear gloves, to not touch them to avoid touching as much as possible, because having a flu, just a flu, could be very dangerous on them. Okay. The fourth group of patients or people are people with chronic illnesses. For example, anyone with a heart disease, a chronic heart disease, um, their heart's immune system actually is tired from fighting for this long time, for this long period of time. So when they get an illness, it's not going to be that severe on them, but they are more prone to have infections because their immune system is kind of weaker. So they are going to have infections, for example, have flu episodes more than a healthy person. Okay. The fifth point is crowded or low resource settings, and this is actually a global problem. You have, let's say, small countries or small villages that are sometimes ignored or have low resource settings. They don't have that much professional hygiene methods, and sometimes, not all of them, but I'm talking about the ones that are ignored. They are actually ignored by the public health institutions, so no one can reach them, no one can advise them, and thus they are going to have more and more infections because of poor education and poor knowledge. Protecting yourself, or sometimes wearing a mask or having a vaccine, is not just to protect yourself. It actually can protect the people around you, your family, your community, your society. So, according to what I said, why these precautions exist, it's first to interrupt the chain of transmission. As we said before, wearing a mask is going to cover the portal of entry or the portal of exit for a respiratory infection, for example, a flu or a COVID-19 virus. And thus, you are going to protect yourself and protect the population around you. You are going to protect your parents, your community, and it's going to reduce the outbreaks and epidemics. Okay, what is an outbreak? This is actually a public health term. So an outbreak is when there is an increase in cases, in the number of cases in a small area. For example, you have, let us imagine you went to a wedding or to a party, and there's the chef who is making the food, and by accident the chef was let us say they were sick and they didn't wear gloves, they didn't wear mask, so they transmitted the infection to everyone who ate the cake. So everyone at the wedding, let us say 200 person or 300 persons, they all got the infection. They are all at a very small place, for example, a wedding. So this is an outbreak. So overload in healthcare systems is actually a very bad thing and a very risky thing. You know that hospitals actually, it's not just to protect or just to let the healthcare staff focus on certain patients. No, actually, the healthcare systems, for example, a hospital is a place that is overcrowded with microorganisms and with infections. So having too much people there means too much microorganisms and thus too much transmissions of infections. So the overload in healthcare systems is a bad thing, and public health institutions actually work very hard in order to prevent this. Okay, so examples of precautions, as we said, hand hygiene, masks. You have isolations and vaccinations. Vaccinations is a really great thing actually to prevent, let us say, the infectious diseases. For example, let me give you a great example. You have at Africa, I don't know which specific country in Africa, but there is a huge spread of a disease called malaria. Okay, malaria is an infectious disease or a contagious disease that is transmitted between people. It's transmitted by insect bites, by mosquitoes. So they tried their best to kill all mosquitoes in Africa, but it is actually something impossible and something very hard on them. So there is a developed law by the public health institutions at Africa, just specific for Africa, is to have vaccinations against malaria. So they reduce the number of cases at Africa because of these vaccinations. So sometimes vaccinations can be a good method of precautions. So according to what I said, what are the consequences of ignoring precautions? There are going to be a rapid spread of diseases and thus more outbreaks, and thus more crowded people in a hospital. There are going to be increased complications and deaths if there is if there are no precautions and people are not following these rules. These diseases that can be mild on you, for example, a flu or influenza, can reach these people with a weakened immunity and can be very risky on them. They can have bad complications and sometimes deaths, especially for the ones with cancer. You also have overwhelmed hospitals, as we said before, and also social and economic disruption. So overwhelmed hospitals, or the increase in the number of a disease. For example, in COVID-19, there are millions of dollars are spent to just buy masks, to just produce masks for everyone, to produce vaccinations. Vaccinations are very expensive, especially to invent a vaccination at that time, and to provide hygienes, hand hygienes, etc., etc. So it's going to be something exhausting for people. Public health is to protect yourself and to protect your whole community. So a lot of people are going to start saying that it's actually my freedom. I don't want to wear a mask. I don't want to get vaccinated or etc. But you must know that your freedom it's not actually considered a freedom if it's going to harm someone else, right? Okay, maybe getting vaccinated is something, um, okay, something related to you. But for example, wearing a mask if you are visiting a relative or if you are visiting someone you know who is treating from cancer or is considered an immunocompromised patient, if you didn't wear that mask, you are actually putting them into a really, really bad risk, right? So public health actually aims to protect the many, to protect people. For example, at Africa, we said they take the vaccination not just to protect themselves, to protect the whole community and to get rid of this malaria and get rid of this malaria spreading to them from mosquitoes that they were trying very hard to stop, right? So rules like masks or isolations are designed to reduce the harm and protect the whole community. And you must know that these rules by the public health are not just made by common sense. For example, the hand hygiene things, eating, I don't know if you heard about it, but zinc or certain vitamins can be very essential in enhancing our immune system. These things are not just common sense knowledge or common sense rules that we heard about. Public health institutions as WHO and UNESCO and UN, etc., they are produced by by a deep and intensive research, by relying on articles and papers that are posted online by scientists, by medical students, by doctors, and etc. Actually, public health is not just an institution of public health of people who study public health. There are some people study public health, and it can be supported by doctors, by scientists, by microbiologists, by a lot of people. So these things you can feel safe if they are. If you hear any rule or any precaution that is by WHO, I don't want to just talk about WHO, by your public health institution in your country, you can. They are usually evidence based and ethical. They are made relying on scientific knowledge and scientific data. You must know that a lot of people might get stigma and might get, let us say, start judging anyone who get actually an infection. Okay, being disrespectful or saying that, being ashamed. I'm sorry, being ashamed from these infections is actually all because of poor education. To say that shortly, poor education actually leads to stigma. There's let us say at 2020, when there is a COVID-19, we can notice that a lot of communities were actually just ignoring anyone who gets COVID, even if they are fully treated, and they are fully immune. But there is kind of stigma because of that. And sometimes stigma actually comes from misinformation. So there is, with the spread of social media and um, people started, let us say, creating information by their own. Like, for example, if you got a COVID-19, you're not going to smell anything for the rest of your life. This misinformation, right? So these things actually happen because of poor education at first and the spread of social media. So a lot of public health institutions um, started awareness campaigns and started to try to get off stigma as much as they can. So actually, there is a stigma for infectious diseases, for non-infectious disease, for a lot of things. Okay.
When looking for hygienic equipment and materials, how do we know which are useful and which are just put for a money grab?
Okay. This is actually a really deep question. Okay, which are useful and which are put for a money grab? Okay, so you can actually, I don't know, I don't work in a government or in some still don't work in a hospital, but I think that the hygienic equipment or materials that are suggested by anyone, they're actually suggested. They are not just suggested by normal persons. They are suggested by people who work at the public health institutions, and they suggest them based on research, deep research, and they actually post announcements on social media, and you can have there are certain advertisements for certain ones, I know, but um, if you are talking about healthcare institutions, for example, talking about a hospital, they have certain guidelines that they follow. They don't just bring anything from their mind. But okay, for example, have hygiene in classrooms. So there are actually, it's controlled by governments, like public health, and the government give instructions to schools and etc.
I've noticed online on social media where there will be a lot of products and doctors persuading to get them. How do we know which one to trust? Like, is there a list or a process of verification?
So actually, for me, I actually follow the verified accounts. Okay, there are some doctors that are start saying, okay, do this and that, but I think you can, you know, I think any one of us has noticed how that caused a really huge problem, especially in 2020. For example, a lot of people started buying. Let me give you an example. When COVID started spreading, a lot of people in my country started buying zinc, the zinc vitamin, because they thought it is protective. Because someone said, okay, zinc is very protective from COVID. You must buy it, or you buy it, or you are going to die, for example. So these things are actually, for me, I will not believe any doctor. Okay, some of them are honest, but you can actually rely on verified accounts, or your public health institution at your country have a certain page on social media. WHO have a certain page. And to trust doctors, I'm not saying that don't trust any doctor, no. To trust any doctor who is giving you a health information, ask them about which source they relied on. For example, a lot of them will refer, if they are honest, will refer to a source or to a research, or to a law from the public health institution at your country. So this is how you can make sure.
As a third year medical student, how has studying infectious diseases changed the way you approach everyday health precautions?
Okay, this is actually a great question. So we started studying infectious diseases since my second year, and when we started going to the hospital, I was actually at the first really scared of getting an infection from the hospital. So it's not related to being worried every time, and I said that at the beginning. I just started watching out what I am touching, and if I want to shake hand or to, let us say, check on a patient, I actually wear gloves so they feel safe and I feel safe. um, yeah, I started, let us say, caring for my patient's health, and for my health too at the same time. So, and I kept using the hygiene every time, like anything I touch, I will hygiene my hands.
Do you know how we find those verified sources or verified doctors on YouTube, like a specific website?
Okay, I'm actually not that sure. It depends on your country. For example, we have a health ministry at our country. We actually usually follow on their specific pages, so you can search for one for your country too. There is a ministry for health in each country, so you can search about it.
Every day, new hygiene products come out, and people claim they're for precaution. How would we able to tell if this is actually working or if it's a marketing strategy?
Okay, so I think it is. It depends. Okay, so for me, I watched a documentary a month ago, and um, most of um, the let's say the companies that are producing these hygiene products, they just change the way that this hygiene, for example, smells. They change its color. They add certain chemicals. But according to a documentary I watched before, all of them work the same. All of them do work. It depends on you and to how many times you are using it, and how effectively are you using it. So sometimes using hygiene too much is going to kill the normal flora on your hands. This is out of your question, but I just have to mention this. If you use the hygiene too much on your hand, you're going to kill the normal flora, which is a beneficial bacteria on your hand. So don't use hygiene too much on your hand. This is the first point. And the second point, according to my knowledge and according to a documentary I watched before, all of them work the same. They just change the color and the smell.
So thank you again, Sulaf, and thank you for everyone for joining us today. We hope you found this session helpful and learned something new about breaking the chain of contagious diseases. Before we sign off, please take a moment to fill out the quick feedback form. It will help us improve future webinars, and you can also let us know which topics you'd like to see next. Don't forget to follow the Kindness and Smile Zone for updates and announcements about future events. Thanks again for joining us, and we hope to see you at our next webinar.